If your hip pinches when you squat, kick, or sit, this video is gonna tell you not only why, but exactly how to fix it. I'm Dr. Neil Toussaint with TrickStrong, and today we're working with Rustic, a Hollywood stunt performer and athlete that really wants to get back to what he loves. Unfortunately, an injury's got his hip pinching, so let's go help him out and see what we can do. Hello, we are here with Rustic. How's it going, man?
Good, man, how are you?
Good, good. So you're here for your hip?
Yes.
Can you give us an idea of what's going on?
Yeah, so a couple weeks ago I was doing some tricking and I was throwing roundhouse flash kicks, and I feel like I landed pretty hard on this leg over and over.
Okay.
And normally that happens with me where my hips just get tight, but the tightness hasn't gone away. And it kind of hurts when I kick, and I feel like a pinching sensation in my hip.
Gotcha. How long has it been?
It's been this way for about 3 weeks now.
Okay.
Yeah, I've been going to hot yoga as well. It's been helping a little bit. But yeah, the tightness is still in there.
Okay, cool. So you said you feel it with squatting too, right? You said that before.
Yeah, I feel it when I'm squatting. I feel like a pinch in that hip. And sometimes, I don't know if it's related, sometimes I've started having a little bit of like a shooting pain once in a while. Okay. Which I never had before. So.
Gotcha. All right, let's handle it. So first I'm gonna have you do a squat.
All right.
Yep, so you can face that way.
Okay.
And let me know when you feel it.
Okay. Right now.
Right there?
I feel it right there.
Okay, and then come back up. And then I'm gonna have you sit here. So we're gonna check your hip mobility first.
Okay.
So you got this easy angle. We're gonna use it to assess your rotation because a lot of times with that hip pinch, it could be an internal rotation limitation. So we're just gonna see if that's the case.
Okay.
All right, so.
Do you want me to do anything?
No, you're good. I just wanna see when you start turning. And I would say right there, you're running out of hip movement. So that's 32 there of internal rotation. We're gonna check this side. We're like 27, 28 before you start moving. So it's a little tighter. And for people who don't really have the reference of like I've had people that come in that have a 3-degree difference and they feel like their side is completely different. And that's obviously more body aware people, but a 3-degree difference is significant is my point. And this is like about 5 or 6. So that is a limitation in your rotation there. So let's see the other side. So this is external rotation now.
Okay.
Oh yeah, you're pretty tight there.
Yeah.
So you have 29 there, but typically we have more than internal, so that's pretty tight. And then, so this is 31.
Okay.
So your total arc of motion is more on this hip than this hip. So it can go in both directions more on this hip than this hip. So this hip is definitely needing some mobility to help you out. So you're gonna lay on your back. So this is your quote unquote good side.
Yes.
I don't like saying good and bad.
Yeah, me either.
Are you feeling anything there?
No.
Any pain?
No, no pain.
Okay. So this is a hip impingement test. You feeling anything there?
No.
Okay. I'm gonna have you come over here and see this from this side. And just look at that range there. We're gonna compare that to the other side. So we ideally want that to be flat.
Oh, really?
Yeah. Yep.
I have tight hips.
Come this way, please.
Yep. Probably why you heard it. Probably why I heard it.
Definitely.
Both.
Oh yeah, so this one, let's get an angle from this side because hopefully we saw the first hip got to like 120 and this one is like at 90 and we can't really go much further. Are you feeling that pinch start?
Right about there.
Yeah, so this one's a lot stiffer. And yeah, so you feel that. So that's that hip impingement sign and he felt it immediately when I'm just gonna do it lightly.
Yep.
Just let me know when you start feeling it.
Okay. Right there.
Yeah, so that flexion, adduction, internal rotation that we talked about is limited here. And then from this side, we can compare.
He's laughing.
So I'm gonna have you come over here and look at this side compared to the other leg. So we'll do a comparison in the video and we'll see this is definitely higher. So we're going to work on your hip mobility.
Okay.
And I think that's going to help clear things up because what's happening is you're getting pinched in your hip. Like there's not enough space in the joint.
It's compressed itself somehow and it's just stuck kind of.
Right. So if you imagine like a towel, right?
Yeah.
Basically, it's like wrung. It's in a very tight position. So we'd want to create more space so it has more freedom to go in each way instead of being caught up in there. So basically, we want to do that through rotation because it's going to help all motions of the joint. One last thing, I just want to see, because you said you had shooting pain down your leg.
Yeah, sometimes. It started going away again with the yoga, but just random like dull pain that would happen.
Yeah, so that sounds like it could be coming from your back.
Yeah, okay.
Especially if it's passing your knee, it's pretty much coming from your back. But a lot of times, that could be due to the hip tightness that could affect your back. So maybe when we clear this up, that also resolves. But I just wanted to do a little test real quick. So you're gonna sit facing that way.
Okay.
And then you're gonna come towards me. Sweet. All right, and then you're just gonna kick this leg out and you're gonna flex your foot. Do you feel anything shooting?
No.
Okay, you're gonna keep that there and then you're gonna slouch. And then you're gonna look down with your head. Do you feel anything there?
Oh, I do feel,
you feel that
something, yeah.
That symptom that you were talking about?
It's not the symptom, but I definitely feel the nerve, like it's tight.
Like it's the same path, but not the same quality.
Yes.
Yeah, so it's just a lighter version of what you normally feel.
Yeah.
So what I'm gonna have you do is you're gonna go back down just for a second, and you're gonna try to get that feeling again. So go ahead, and let me know when you're there. You feel that now?
Yeah.
Okay, so you're not gonna change anything except your head. So you're gonna look up with your head. And does that change it? Does it make it less or more?
Yeah, it went away.
Went away. Yeah. So we know that it's coming from your back because nothing connects from your spine to your leg that's muscular. It's only gonna be nerve that could connect that far.
Okay.
So that like confirms that there's a nerve thing as well. So one exercise I would give you are sciatic nerve glides. Okay. And that's gonna be something that basically helps move the nerve. Okay. All you're gonna do is kick your foot out and then back down. So it's like a leg extension basically.
Okay. Do I flex my...
Yeah, you can flex. For you, I would flex because it took you a lot to feel it. So you're more advanced, I would say. You don't have to do the motions as much with your foot. You can keep it flexed.
Gotcha.
And then what I would say even is, are you feeling it at all?
No.
So what I want you to do is like find where you would feel it and then back off very slightly. Yeah, so it's pretty deep there. So.
Yeah, it's about there somewhere.
So if that's comfortable for you, you're gonna hold that position because we wanna stress the nerve, but only barely because nerves are very irritable, so you don't wanna piss them off. And so basically you're trying to feel like a 1 out of 10 of that sensation. Yeah. 1 to 2 out of 10. And then you would do, anywhere between 30 reps, 30 to 50, but you can go way faster than that. So this has nothing to do with muscle. We're just trying to move your leg. So yeah, you could do it at that pace. I'll probably speed this up in the video. It'll look really funny. And then come back up and just let it shake out for a sec. And then see if you can go any further, if you feel less.
Yeah, I got to here now.
That's where you start to feel it?
Yeah.
So that's way deeper already, obviously, because before you were probably around here when you felt it.
Yeah.
So that's really good. So we know that, all I'm trying to do with these tests is like, why I do test retest is to determine if the exercise is gonna work for you. Okay. It's not to get like 100% resolution, obviously, but like that was a really good result with just like, you did it for like 60 seconds. Yeah. So obviously doing that is gonna help with that nerve pain. So that would be your one for the nerve exercises. I'm gonna work on your hip first, and then I'm gonna show you a couple more of the hip exercises as well to open up the space.
How often should I do this exercise that I just did?
So this exercise, you can do about 30 to 50 reps. If you don't wanna count to that, you can just put a timer for a minute or a minute and a half. That's what I tell my clients a lot of times. And you do that same pace that you were doing.
Like once a day?
And then you do it 1 to 2 times a day, I would say. Probably twice a day, ideally. You do it morning and night. It's really good to do it in the morning because a lot of times that's when your back is stiffer and then you get more of those symptoms. So sometimes I tell people not to even get out of bed yet and just to do that immediately. Okay. And then go from there. I'm gonna work on your hip. I think that we can really loosen up a lot of the tension in there. So what I'm gonna have you do first is we're gonna go face down. The glutes rotate the hip. And the glutes are probably very tight right now. Glutes are one of the rotators. And also the sciatic nerve runs through the glutes. So I imagine your piriformis, which is a muscle in the glute region, is going to be pretty tight. And that's where that muscle is. You feeling that?
Yep.
Yeah. What I typically do in clinic is I do everything skin on skin. So is that cool if I
Yes.
drop this? And then maybe you have to loosen up a little
Yep.
bit. That is the main one I want to get right there. That's your piriformis. The piriformis runs from the sacrum to this part of your femur, the greater trochanter. It's right in the middle. It's like a diagonal across the butt. So we're right in the middle here is where the sciatic nerve runs through. So I'm going to try to loosen that up with needles. We're going to do some dry needling to open up that space and hopefully have it not pinch as much, because that's one common area that it's going to get caught in. And with the hip tightness, I think that could be contributing. So dry needling is a treatment that really helps with muscle tightness, helps with mobility, and helps with pain. It helps with blood flow because we're getting blood flow right where the needle goes. So I'm going to go right here. That needle can pretty much go the whole way.
Whew.
You okay?
Yeah.
So sometimes you get a twitch response, and that twitch response is the muscle. It's like a chronic tightness in the muscle that then relaxes, and it allows that tension release. Along the piriformis. Also, I'm feeling for tight areas in the glutes. Areas that have a lot of tone in the muscle. Okay.
Yeah.
It's a feeling.
It's a feeling. Whoa, ho, ho. It's like a dull pain, but it's good.
That's exactly how I describe it. It's a dull ache.
Trust you.
It's crazy.
Yeah, you're not usually on this side.
Yeah, I'm not usually on that. That's crazy. I'm like, whoa. I know what you're feeling. That's what I'm like, wow.
So we'll do one more. It's gonna look even crazier when I attach the stem to it.
Yeah, I usually never see that part. What?
Alright. So it's a pretty good start. So basically all the effects I said with the dry needling are going to be enhanced by this stem here. So that our whole goal is to just, again, get blood flow in there, loosen the muscles, relieve tension, pain, improve mobility in the hip. All right, so I'm going to start very slow. You let me know when you start to feel it, right?
Okay. Yeah, slow's good for me because
Yeah. It's a little
I
intense.
feeling something.
You feel it? Okay. Let me know when it's strong but comfortable, meaning we're going to do this for about 5 minutes. I don't want you praying for it to be over.
Okay.
So I'm going to go up on those two.
Okay. There's
there?
pretty strong and comfortable. Yeah, comfortable. Yeah. It's like
Okay.
twitching. I can feel it.
Yeah, it's twitching for sure. And then there's another channel. So those are the bottom two. We're going to do the top two as well. So we're going to do this for about 5 minutes. Let it do its thing. And then we're going to do some more treatments to help loosen up the hip. And then we're going to retest his mobility.
Okay.
I'm just going to take these out. A lot of people talk about gloves with dry needling. The research has shown that the hole that the needle leaves is so small that the infection risk is like 0. So that's what I learned in my courses with dry needling. But some people do it, and that's fine. But for me, I don't like that because then I don't have the same tactile feel. Because it's actually crazy. You can feel the tissue through the needle differently than when you're doing massage technique or something, for example. So I could feel different parts, different layers of what's going on, basically. So I like to test after, and it does feel a lot looser already. Yeah, that's way less tension in his hip from the needling. So I like to start with the needling, kind of use the big guns, and then clear up anything else out that I can find afterwards. So I'm on the muscle, so I'm on his piriformis, and I'm shortening and lengthening it so it helps release the muscle a lot more than if I'm just doing static massage. So usually very active with these techniques. Either I'm moving him or he's moving himself, and I find a lot better results with that. Yeah, a lot of this, tightness is neurologically mediated. It's not like the muscle is suddenly shorter. It's the nervous system deciding, hey, there's an issue here. Let me protect it.
Right.
So like when you jammed your hip,
Yeah.
your body was just like, we need to protect this area because something happened here. And sometimes if you don't do exercises after the fact, that's like its new set point. And so when we use things like dry needling, for example, it temporarily changes the set point back to a looser one. And then we reinforce that with movement.
Okay.
So definitely not just this kind of thing, but you want to reinforce it always with exercises, so like strength and mobility.
Okay.
But this is a good way to kickstart the process. All right, so I'm gonna have you flip over. Yeah, it's probably pretty bright now.
So bright.
And then the last thing I wanted to work on is your TFL and your hip flexors.
Okay.
So your TFL rotates the hip, it's also a hip flexor. And then maybe we'll work on your psoas a little bit. Yeah.
That is tight.
So if you're cool with it, I'll do one more needle. I'm not gonna stim it, but I just wanna
Yeah.
go around a little bit.
Absolutely. I'm a little scared, but I trust you.
All right, so this is the TFL. So do that motion again, so push into me. See how that pops into my hand and then relax? So that's the muscle we're gonna be targeting. That's his TFL, and that's a hip flexor and internal rotator of the hip. So we just worked on a lot of his external rotators with the glutes. Now we're gonna work on this one, and this should help out as well. All right? You feel any twitches?
It's just, no, not twitches, just dull. Yep, twitches now.
Cool. Sorry, I'm almost done. I just want to get a couple twitches because that's gonna release it.
Breakthrough. Good.
All right, and we're done. Good job. And so I always reassess, and it does feel a bit looser, but we're gonna do more with the manual therapy.
Okay.
So again, we're just taking it through the muscles range of motion. So we're just stretching and shortening it. People think of muscles as one thing, but it's thousands of fibers of things.
Okay.
So, and that even goes to our training. It's like, oh, I'm training my bicep, but like, your bicep isn't one thing, it's a whole bunch of things. So if you only do this, you're only going to train a certain line of it. So training in different angles helps get different areas of the muscle. So same with this, like the answer wouldn't just be like, all right, we've got to progress our squats, like very linear motions. We got to do rotation drills to improve all the muscles around the hip, not just like one line. Even pigeon, for example, you're just in one range. You want to explore in pigeon so that you're getting all the different fibers, if that makes sense.
Yeah, absolutely. That does make sense.
All right.
Yeah, my pigeon has been horrible for years. I've never been able to get good at it. I need to do more.
I have a couple drills that are pretty good.
Perfect. I feel like you know what you're doing.
All right, so yeah, this one's a little weird. So this is the psoas. There's organs and things in the way as well, so we got to kind of have to like be a little gentle and go around them. You're gonna push against me a little bit. That's how I make sure I know I'm on it, and then relax. All right, so I felt that contraction, so we're good.
Yeah.
So now you're gonna slide. You're gonna slide your heel.
All right.
Yeah, just straight down and back up. We're gonna do 5 of those. All right, good. And relax. So I'm gonna have you come towards me and we're gonna just retest and see how you are. Do anything for the camera, just let me know how you actually are, obviously.
Okay. Yep.
So first thing we're gonna do, yeah, sure. So the first one, remember when we were bringing your knee towards your chest, when do you start to feel the pinch?
Kind of there, maybe.
You just started there to feel it?
Yeah.
Can you get a side angle of this? Because I think we had a side angle from the beginning. That is way further than you had before.
Yeah.
So when my question to him before was, when do you start feeling the pinch? In the beginning of our session, and we were just doing hip flexion like this. And you let me know when you start to feel it.
Right there.
Okay, so hopefully I have an angle that's similar. Like you were at 90.
Yeah.
You were a little more than 90 before. You were probably around here, so you got a good like 10, 15 degrees there. Next one is this hip impingement test. So you let me know when you start to feel a pinch.
Okay.
You feel it there?
Yeah.
Okay.
Try again.
And let me know when you just start feeling it. Right there?
Yeah.
Okay, good. All right, so what I'm gonna have you do, it's another technique we can do, is I'm gonna ease off of it slightly. You're gonna push into my arm. So what I mean by that is you're trying to get out of the range.
Okay. Gotcha.
So you're gonna be gentle though.
Okay.
All right, go ahead. Yeah, perfect. 4, 3, 2, 1, relax. We're just isometrically working on it. And then you always let me know if or when you're getting a pinch. Okay. So we're trying to stay right out of it.
Starting to feel
So,
right there.
okay, so push into me again. So right now what we're doing is we're using isometric loading to create space in the hip. And relax. Again. And relax. Nothing yet?
A little bit right there, yeah.
Okay,
Something
again.
there.
Hold. And relax.
Right there.
All right, and last one. You're getting stronger though in this position.
Yeah, I
and
feel
relax.
like I'm getting stronger in a position. I'm also pushing harder.
Yeah, relax. Well, yeah, I mean, your neurological system is like learning, hey, this is okay.
Yeah.
It's not always going to be pain with it. So we have to like re-teach it how to engage in these painful positions or near the painful positions, and then it allows you to do more.
Okay.
But that is more range for sure. Obviously, the pinch is going to be all gone today, but you have a lot more internal rotation there.
Okay.
All right, so we're going to sit up. The last thing I want to look at is your hip rotation. I mean, you're going a lot further.
Yeah.
Yeah, now you just started moving, you're at 36.
Yeah.
So that's like a 9-degree difference. So that's really good.
What are you looking at when I'm starting to move exactly?
When your hips, when your lower back starts to move.
Okay.
So that means that we've taken up all your hip mobility and your body's trying to figure out like where else it can get it.
Gotcha.
It's like compensating. Yeah, you got a lot more there. So you got 39 there.
Yeah. Wow.
And you could see like just the freedom was a lot more.
Yeah, it feels better.
Okay, last thing we wanted to actually check was the squat. So I'm gonna have you squat down. Let me know when you start feeling it.
Just at the very bottom. Yeah.
That's awesome. You were at around 90 before, like you were parallel before, so a lot deeper.
Yeah.
Great.
Yeah, feeling it right at the very bottom.
Perfect.
It feels a lot looser now than this one.
Yeah. I mean, it is actually. We actually see that it got further than the other side. So now we just have to reinforce it with movement. Okay. So that one I just showed you that we were just doing together, I could show you how to do that at home.
Yeah.
There's a banded hip mobilization to expand space in your hip.
Okay.
And I'll show you a pigeon contract, relax, stretch. And maybe a kickstand RDL. If you guys enjoyed this video and want to get more insights on how to fix this issue, check out this video next, which breaks down the exercises that I gave to Rustic and more.